Okay, so today we're going to do a demo of wet cupping. And so my patient has chronic pain in this spot right here. And it's this erector spinae muscle is very tight. If you palpate it, you can feel that. We have tried a variety of things, and wet cupping on her seems to provide the most relief from the pain. So the first step is to clean the area, which is what I just did. I'm going to put gloves on in just a minute. Actually, maybe I'll go ahead and put gloves on. It's very important to have gloves on if you're doing anything involving bleeding, which of course wet cupping is. So okay, and so the first thing I'm going to do is to prep the area by putting some oil, this is lavender oil, on the area and using gua sha to get up some of the qi and blood stagnation. So here's my gua sha tool. Does this feel okay?
Yes.
Okay. So you can see how much stagnation has already come up just from that. Okay. You're doing okay still?
Yes.
Okay. All right. So next, I'm going to just make sure I've sterilized the area. And this is my 91% alcohol that I'm going to do glass cupping. But before I do that, part of the step of wet cupping is to use a lancet or a 7-star needle to just tap on the skin and allow some exit points for the stagnation to come out. So this is the 7-star needle. The technique is to just let it bounce off the skin, and you don't usually see bleeding from this. You don't want to hammer it. You just want to. You doing okay?
Yes.
So as you can tell, it's not really making any bleeding marks, but it is providing some entrances to the skin to allow the blood stagnation to come out. Okay, so she has a spot in particular right there, which is, and if you feel this, you can feel how tight this muscle is. So I'm gonna put a cup on this spot. You can see right there some previous cupping that we did in the area. I'm gonna put a cup here, but also all around it as well. So I'm getting these nearby. I'll get an extra one just in case. And so now I'm gonna douse my hemostat into my okay, and dousing the fire in my water, and you can see that there's already some blood that's coming out. You could even see, this is where the spot is, you can even see it starting to coagulate within the jar. That's the pattern that I've seen with her, that when the blood comes out, it sort of rejoins to itself and kind of creates these like strings. I'm not sure if that's going to happen today, but that's what's happened in the past. And it's like a really solid like string of stagnant blood that I can actually pick up and hold. So we're going to let this sit for about 10 to 15 minutes, and then we're going to film what it looks like after it's been sitting on for a while, and the final step of removing everything as well. All right, we have left the cups on for I think about 15 minutes, 10 maybe. And so now it's time to take the cups off. You have to be sure you have gloves on. And so I'm going to start with this one. That's not where I hit it with the 7-star needle, so I don't expect blood, but you can tell that there is some stasis there. This one didn't really have any 7-star needle on it. The main one I'm going to take off last. This had a little, but not much. So now this is the one, this one is the actual spot. And we can see, this isn't actually as much blood as what normally has come out for this patient, but we can see how it has recoagulated back out. So just, I'll let you get a close-up of that. Okay, and so now I'm going to clean the area. Disinfect it.
And while these cups were on, we put Becky put a Moxa box on the low back area on the bladder channel, just to infuse and more tonification to harmonize.
And I'm gonna put some of this oil on it again to kind of moisturize the area. And we advise the patient to drink a lot of water later today. Throughout the day, she should expect to be a little bit more tired than normal, and to get enough rest and to eat healthy, and to avoid taking a hot shower within 24 hours since this area has been exposed. So the last step that we're going to do, that I'm not going to demo, but I just want to let you know, we're going to put Moxa cones on bladder 43 to kind of tonify her and give her, help her body to recover from this.